It should be good now. And then I was just looking at the recordings that I have in there from last year, and there are 1, 2, 3, 4, 5, 6. There's 6 videos that are basically me talking about these PowerPoints, and I chunked them into like the first one's 22 minutes, the next one's 10 minutes, the next one's 21 minutes, 10 minutes, 22 minutes, 10 minutes. So I chunked them for some reason. I don't even know. And I hesitate because it was my first year teaching it. So sometimes the concept, I'm kind of like, oh, what did I actually say? But I think it's better that you have something than nothing. So I'm going to open them up and let you watch them. Yeah.
Is it still okay if we do record?
Yes, I'm recording it now. I'm recording it. And yes, it's totally fine. But I just want you to know that's my caveat is that, oh, hi, the internet was down.
It's up now. If you just disconnect from Box Wireless and reconnect it.
Okay, thank you, Leah. So yeah, so I just want you to know that those videos might not be my best work, but they're there for you. So I think it's better than nothing. Take it away. Yes. I know, it's funny. Okay. You can tell everyone likes chocolate better. Okay, so let's go. We have like 25 minutes, so we're almost to the end, but we're not actually to the end of this thing because we're only on slide 23. So good news is you're almost done with class. Bad news is you're gonna really have to watch these videos on your own. And I'll look at what we're talking about next week and make sure we have time to answer questions. And then next week's lab will be lots of at the table. We can spend time reviewing stuff. We can go over these concepts. So there is time to like make sure that we're getting all this in our brains. Candy, did you have a question?
Oh, I'm sorry.
You're good.
I'm just making motions for what's going on in front of me.
You're fine. You're good. Okay. So ghost image. So another example, here is another example of a ghost image, the palette. So the bottom arrow is pointing to the real hard palette. The real hard palette. This is not just a big, thick, white, hard palette. It's the bottom thin and then somewhere in here, there's a less dense area. It's hard to see because you could say, oh, that just looks like a big, thick white line. But it really, truly is 2 images. It's a real hard palette. And then up here, the top arrow is pointing to the ghost image of this palette on the opposite side. So this right side of the palette is a ghost image over on the left. And this lower part of this white line is the real image. The upper part on the opposite side is the ghost image. So a lot of times the images can be so close together, they kind of blend, but sometimes you can see contrast difference. So you can actually see like a lighter gray area between the 2 white palettes. Oh. It's like looking at tricky photographs. Okay, so soft tissue, cartilage, how does soft tissue look on? So when we think of soft tissue on a pano, we're going to think of earlobes. Sometimes you can see the earlobes. Sometimes you can actually even see the nose. Things like the soft palate or the tongue. So things like that will show up in a pano. So the arrows here, this is pointing to the soft palate. So it's kind of weird because it's like, okay, here's the soft palate, like here's the hard palate, but the soft palate's way over here because it's going down farther, back this way. But things that are back further are going to get splayed open flat and show up more on the sides, just like you think about the way the spine shows up on the sides. So it's deeper back into the image. And so you're going to see it more on the sides. So the top, again, we have like the top part of it is a ghost image of the opposite side. The bottom image is the real image. The tongue, it can also show up in the image. I don't know that we see it very good here, and then sometimes you can actually see an outline of the lips or earlobes. We have a couple examples where we can see the earlobes pretty good, but you can't really see it on this one. What is that? That's a sad face.
That's like how you're not.
Yeah. I was drawing a rainbow and I left all the colors out except for yellow. Why is it there? Oh my word. Oh, there's more. It's like every time I push the button, more pictures gonna come up. So what I know what this is now. I was outlining the air spaces, but where's my pano? There it is. Oh my gosh, that's so silly. Okay, so air spaces on a pano, I meant it to go the opposite way. It's like first you'd see the picture and then the air spaces would show up. It didn't work out. Okay, so air spaces on a pano are going to show up pretty dark and they're going to obscure a lot of stuff. And you think, well, why in the world would air obscure stuff? But it's just the way the density, it's the way, and I don't thoroughly have like the best like technical, but you're just going to have to remember certain things and remember like what obscures what, and we'll work on that in a minute. But airways have a tendency to obscure some hard tissue stuff like apices. So this dark area here, this is the palatal glossal airspace. And the way that's easy to remember that is palate, the roof of the mouth, the palate, and then glossal, the tongue, the glossal, and you want the tongue up on the roof of the mouth. And if you don't have the tongue up on the roof of the mouth, then you're going to create a palatal glossal airspace. So that one's pretty easy to remember because it's part of the instructions that you're going to give your patient. Tongue on the roof of the mouth, keep it there the whole time because you want to like fill up that space so you don't have an airspace. The next airspace is going to be the nasal pharyngeal, and that comes up in this area here. Nasopharyngeal, and you can kind of, I guess you could kind of think about, because it kind of looks like it's heading up toward where the sinuses are. So I guess that kind of is a thing you can think of to help you remember. And then the last one is the oropharyngeal, and it runs down like it kind of, you can think of like it's running down into the throat or something. So nasal or palatal glossal, nasopharyngeal, oropharyngeal. We'll look at some more images here. That's a good one, huh? So now this is kind of, we're going to step away from that airspace for a second, and this is just thrown into the slide deck. But how old, this is probably, I think this would take too much brain work for me to do it at the moment. And so I know you guys are probably too spent to do it. But is this, for one, let me just ask simple, is it an adult or a kid? Oh, okay. There's a lot of teeth coming there. So what you might want to do for fun is to try and figure out, although I think you guys can see my notes, so you probably will just do that. But try and figure out if you can tell how old this patient is. Because you guys, have you been talking about eruption dates? Yeah, so try and figure out if you can tell about how old. We don't have to do it now because we kind of don't have time. But look at the slide deck and see if you can figure it out just by looking at the teeth. Now, just to give you like a hint, obviously everything that's forming are his or her permanent teeth. And then there are some teeth in here that are permanent. Here and here, we got the 6-year molars. Oh, sorry, oh my word. So here's 6-year molars, 6-year molars. And then all of these are baby teeth, and you can see the adults coming down below. And then here they have their adult central and incisors on the maxilla and the mandible. They have their laterals. So they have all of those and they have their 6-year molars. So when do central and laterals come in? So what's it kind of a safe age range? They don't have canines, which when do canines come in? Is it 10 to 11 for canines? 10, 11? So they're probably not quite 11. They definitely aren't 12 because their 12-year molars aren't in. So they're probably like 8 or 9, maybe 8, maybe. I don't know. I'm thinking 8-ish, but that's just me. Okay.
But it could be earlier, right?
It could be earlier. Yeah, it could be earlier because kids they exfoliate and come in at different times. So it could be earlier than 8. Yeah, they could be 7. They could be 7, 6, 7, 8, probably. I'm thinking they're a little bit on the younger side, especially when I see how much they have to still develop their canines. There's quite a bit there. So I'm thinking probably a little on the. Yeah. Okay. So here's another. I must have done something very strange with the animation. Okay, so we're going to talk about understanding the density changes in a piano and why some things obscure other things. And I don't know how deep into the why, but just the fact that you need to remember what obscures what. So just a quick, just saying it until we get into the more detail. Air spaces, that palatal glossal space, the nasopharyngeal space, that obscures hard tissue. So it specifically obscures hard tissue. So these kind of you pair them up, you partner them up. Soft tissue, so then if we have like a tongue or a soft palate in an airspace, you're gonna see the soft tissue and the airspace kind of disappears. That portion of the airspace that has the soft tissue in it. So soft tissue obscures the airspace. Hard tissue, like anything in the face that any bone that's hard tissue is going to obscure soft tissue. So you're going to see, maybe the ramus might obscure, maybe if the soft palate. I'm trying to think of what's on the sides there sometimes. Hard tissue. There's probably an example. There's probably an example somewhere. We'll find one. And then ghost images obscure pretty much everything. So when you have a ghost image, it can be laid over a whole bunch of stuff and it can hide the detail of many, many things. So some examples, let's see. So I think I gave you an example of the airspace obscuring the hard tissue. So another good example of that would be the airspace obscuring the apices of the teeth. That's a really common one because if you don't have that tongue to the roof of the mouth and you have that airspace and the patient's positioned just so, it could wipe out all the maxillary apices. So here's another image of the air spaces. So one is the palatal glossal. It's up along here. 2 is the nasopharyngeal, kind of heads up kind of toward the sinuses. And then 3 is the oropharyngeal. And look, maybe like you could say it's going down the throat or something. Here is on this side of the image, you can see here's the nasopharyngeal. Here's the palatal glossal. And then the oropharyngeal, and then it's not highlighted over here, but you can kind of see this whole kind of gray area through here as it comes down. And then you can kind of see how another little, like, it almost looks kind of like this shape right there. Like it's a little darker gray here and a little darker gray through here. Can you kind of like squint your eyes and don't look at anything but this kind of gray. So that's the airspace on the opposite side. But this whole dark area right through here, here's your palate, and this whole kind of black space here, that's the palatal glossal airspace. So they didn't have their tongues smashed up to the roof of their mouth because there's that black line all through here. Do you guys see that? So that's the airspace. So a lot of times you'll see this nasopharyngeal coming down over the condyle, and then you can see the oropharyngeal kind of coming through the mandible and then going down the side.
I wish I understood because like isn't it the opposite kind of in like radiographs that we've been taking, like PAs and stuff, like the hard tissue is obviously like
Hard tissue will still look what dense things will still look white, but it's the way like you can, but it gets confusing. You can't quite think about it the same way because like an airspace, which is just air, that darkness of the airspace can overlay hard white things. And so when we take a PA, we're looking so specifically that we don't have to worry about any of that. Just what's white shows up white, but there's so many layers of things, and it's the way the x-rays come through all these different things that's why we're picking up like air spaces and hard tissue and soft tissue in one like x-ray shot. What's that? Just trust me. All you have to do is the thing that you guys have to get good at is identifying what is normal and abnormal on a pano, and then knowing how you need your patient position. You don't really have to understand the nitty gritty of why it happens. You certainly can do more research, but why add that? Why add that stress? Just you want to be able to identify stuff on the films. It's all about identification. The green, this is just highlighting the air spaces on the right side, and then it's left open on the left so you can see it without, because sometimes this helps people and sometimes it confuses them. Because so this is like highlighting where the airspace is, and then it's not, there is nothing over here to highlight it, but you can try and pick it out. It's right through here and then up through here. And then the palatal glossal is all through here.
And then on top,
All of this.
Yeah, exactly.
There's sinuses, there's orbits of the eye. So you get some sinus down a little lower, and then you get orbit of the eye. And then you can even see some cranial stuff that we don't even worry about, but you can see some of that. The sinus though is the lowest. This lowest line here is the sinus. It's just the way it's taken. Who asked that? Where did you take it? Yeah, it's just the way the patient's head is and the way the x-rays bounce. I don't know. It's just the position of the patient. Trust me. Okay, so here is another one. This is showing a little bit more detail in the air spaces. You can see this is the nasopharyngeal. See all these arrows through here. This is the nasopharyngeal. This is the oropharyngeal, and then we have the palatal glossal. And this is showing some, so in a drawing form, things that you'll see that are soft tissue. You're going to see the tongue, and you'll see it. The tongue will be, in the picture, the tongue will be divided in two, and you'll see a little bit on each side. So you're not going to see a central tongue. You're going to see a tongue going off to the side. And you also see a soft palate doing the same thing. It's usually smaller though. You'll see like tongue and then sometimes a soft palate. So one is the tongue, a little bit of tongue over here. Sometimes it actually does show up fairly large. Tongue, a little bit higher. It's not always higher. Sometimes it's along the same line, but it just depends. But you might see a soft tissue, kind of a light white kind of area, not bright white, but kind of a mid-gray tone. And then the earlobe will be around the sigmoid process. But because this is the inner ear canal, or the whatever that hole is, median. Anyways, the word just, yeah, external auditory meatus. Yes, that's it. So that's what that is. And then you'll see the earlobe kind of right in that general area. So those are soft tissue landmarks that you might see. So we can see, I don't really like these. I didn't know how to take this green stuff out of the image. I didn't put it there. And so I wasn't sure, but this is basically showing like the tongue might be, in this general area. It might obscure some things or add a little bit of an extra white. The soft palate here, you can see it over here, and then the earlobe is over here. But I don't like that image because I don't feel like it actually shows it very good. Here you can kind of see the arrows are encircling the earlobe there. Number 3. Number 2 is some soft palate coming off the side. And then number 1 is this kind of white, how the teeth look a little whiter through here. It's because it's the dorsum of the tongue, which was not on the roof of the mouth or the palate, because you have this big, thick black area that cut off the apices. So this whole thing is an airspace, and it cut off the apices. But this is where the tongue would begin, right through here. And I guess you can kind of see it coming off the side too, here and here. Okay, so then this is going to show, I think, some more examples of ghost images. So this green is showing how you can have a ghost image of the border of the mandible. So here's your real mandible here, and then over here is the ghost image, this green blocked out area. And then it would be the same thing. This part, this green part is going to be this angle of the mandible here. Down here, 8 is going to be the hyoid bone. And then this whole center, this green area here, sometimes you get a ghost image of the cervical spine. So because the spine shows up on either side, but if it's a ghost image, remember it's opposite, more closer to the midline, blurry, larger. So if a ghost image of the spine shows up, it shows up in the midline, in the center of the piano. The patient, patient positioning. It's all about how you position the patient. Yeah, we'll talk about accurate patient position. You know, the curvature of the spine kind of comes in like this. So we have to get rid of it. And a lot of times you get rid of it by making your patient like lean back, and it gets rid of the curvature of the spine. So they have to be in the piano in a specific way. So this is just showing, like, here's kind of a whiter area. That would be this side. This is the ghost image, this kind of white angled area here is the ghost image of this corner of the mandible. And then it's just trying to show it here. And that would be this angle of the mandible. I feel like this is a really clear image of the ghost image. So because they didn't muck it up with too bright of colors, but you can see how drastic it goes from this gray tone to this white tone. So it's like you can see an outline a lot better. So this whole thing here is the ghost image of this angle of the mandible. And then you can really see it here. It just looks like a big white area. So that is a ghost image of this side of the mandible. And then you can kind of see the spine. See how it's just a little whiter through the center? That's a ghost image of the spine. Okay, I think that's just we only have 4 minutes left. And I just think that's a good place to end.